Rugby has some of the toughest athletes on the planet and some of the most brutal injuries I've ever seen as an orthopedic surgeon. I'm Dr. Ethan Kellum, orthopedic surgeon and one of the team physicians for the Tennessee Titans and USA Basketball. Today we're breaking down 8 real rugby injuries and what actually happens inside the body during each one. A few of these are tough to watch, and the final one is the worst in this video. Let's get into it. Oh, right there, look at that. And I think she might have a concussion. All right, this is Bridie Parker. Watch her leg as she lands. This is likely a non-contact ACL injury. In slow motion, watch the lower leg. The foot plants, the knee bends normally, but the ligaments can't handle the force and it just gives way. This is the ligament absorbing more load than it can tolerate in a split second. This injury usually happens when the foot is locked in place and the knee keeps moving in a rotational force. Pain is not always instant, but weight bearing becomes impossible immediately. The good news is that the ACL can be reconstructed and will usually heal with proper treatment, but this requires time and absolutely no rushing back. And if you think this is rough, the next one is a complete tendon rupture. Oh, right there. See that patella? This one, Elijah Anderson. Watch his knee as he tries to push off. The kneecap shoots upward and the lower leg gives out. This is a patella tendon rupture. The tendon below the kneecap completely tears. When the tendon snaps, the quad muscle has nothing to pull against. The kneecap literally loses its anchor and slides upward. Athletes know instantly when this happens. And this is one of those injuries where a player knows the season is over the moment it occurs. Surgery is required and rehab is long. Strong quads and balanced training reduces the risk, but this one is tough to prevent entirely. And I know how this feels. I had the same injury in medical school playing intramural basketball. I was actually trying to dunk on someone. Now, this is not the only knee injury today that changes everything for a player. The next one involves a decision that shocked even medical professionals. What is he doing? Oh, look at that. Kneecap is not in the right. That's probably not the right thing to do. Joe Westerman. This one is famous for a reason. Watch closely. He dislocates his kneecap and then he pushes it back in place so he can keep playing. I understand rugby culture. These athletes are incredibly tough, but toughness does not protect cartilage. Pushing a kneecap back yourself can tear ligaments, damage cartilage, and cause permanent instability. The kneecap slides out of the groove in the front of the thigh bone. When it shifts outward, it tears the tissue that keeps it centered. Even if you can walk afterward, the joint is still unstable and at a high risk for long-term damage. This is an injury where stopping immediately and stabilizing the joint is essential. Now, you might think that this is the most risky decision in this lineup, but the next athlete actually keeps playing for 20 minutes after his injury and had no idea. Subtle right there. Ooh, see that right there, that little give. Connor wrench. This makes every orthopedic surgeon sigh. Nobody touches him. One plant, one shift, and the knee collapses inward. His body moves forward, but the foot stays stuck in the turf. The shin moves forward under the thigh bone. And this is a classic ACL tear mechanism. The ACL prevents this exact motion. When it's overloaded, it snaps instantly. Non-contact ACL tears are some of the most devastating injuries for rugby players. And this is why strength, balance, and landing technique are absolutely essential. Quick pause. We're only halfway through and we have already seen an ACL tear, tendon ruptures, and a kneecap getting pushed back into place. If you want more breakdowns like this and you want to learn how to prevent these injuries, hit the subscribe button because the last 4 injuries get even more intense. All right, let's keep going. Ooh, you have to be quick with that one. That one's super subtle, but you can tell he is hurting bad. This one looks simple at first, but it's not. Watch his leg as he lands. The knee locks straight and then bends the wrong direction. This is a hyperextension injury. This can bruise the bone, stretch the ACL, or damage the posterior capsule. Sometimes athletes get lucky and escape with only a bruise. Other times it becomes months of rehab. Hyperextension is one of the quickest ways to injure both the knee and the surrounding ligaments. And you know what's even more concerning? The next injury involves an ankle twisting in a way that no joint is designed to handle. Yeah, that's nasty. Jamie Chapman. Watch her foot carefully here. Her cleat gets stuck underneath her and the ankle rotates sharply outward. The twisting force stresses the syndesmosis ligament between the tibia and the fibula. These are high ankle sprains and they are far more serious than regular sprains. They often require a long recovery and sometimes even surgery. When the ankle rotates like that, fracture is also a real risk. You can't push through this one. Proper rehab is essential. And if you think ankles are bad, this next injury affects the shoulder in a way that surprises even experienced athletes. Ooh, shoulders don't normally hang like that. Yep. He needs a little help. Sione Finau. He lands on an outstretched arm and the shoulder pops forward. The ball of the shoulder moves out of the socket. When this happens, you can actually see a lump in the wrong place under the skin. This tears the labrum, stretches the ligaments, and destabilizes the entire shoulder joint. Shoulders can be unpredictable. Some athletes recover in weeks, others need surgery. Falls like this are one of the most common ways rugby players dislocate their shoulders. His foot is, look at his foot hanging there. See what happens. Even the ref can't handle it. The other players are like, let's not look, let's not look. For our final injury, LaRue Milan. Watch how his foot gets trapped underneath him. And right there, the ankle bends completely backwards. It might be hard to see at first, but this is a severe ankle dislocation, usually with fractures of the tibia or fibula. When the body weight lands on a trapped foot, everything above follows through the joint. Rugby players often try to stand up, but with an injury like this one, staying down is the safest thing to do. This requires emergency reduction and usually surgery. When rugby players say something is bad, trust me, it's real bad. These athletes play through almost anything. So when they stop playing, you know it's serious. These injuries are tough to watch, but understanding them is how we prevent the next one. Rugby is an incredible sport, but the forces involved are enormous. Strength, mobility, landing technique, and smart recovery are what protect athletes. I have operated on professional athletes who would give anything to go back and change the moment on the field. And they tell me the same thing. I wish I knew this earlier. So if you are a player, a coach, or a parent, share this video. It could save a season or even a career. Thanks for watching. I'm Dr. Ethan Kellum. Stay strong, stay healthy, and remember, the best surgery is the one you never need.